Now to the real obsession of the alarmists. Perhaps I take some of the credit, having fought them for more than 12 years. Higher altitudes. Before I go on, I should say that malaria at higher altitudes is a red herring. John Christie helped me learn that the total surface area, not the two-dimensional area, the total surface area of Africa that is above 2,000 meters is 2% of the total area. In fact, what we're talking about in terms of creeping up to altitudes is a very small part of sub-Saharan Africa. The various places you can see here are the places where it is said that there has been malaria going to higher altitudes. Here's a quote from Mr. Gore. You may remember the animation in his film where the mosquitoes are crawling up the mountains. And he says, Nairobi, the capital of Kenya, used to be above the mosquito line, the highest point at which mosquitoes can live. Well, Nairobi is at 1,600, as you see, and 8 meters above sea level. Anopheles gambiae, the most effective vector of malaria, probably in the world, the maximum altitude is 3,000 meters. There's very little of Africa that is at 3,000. Now, let's talk about Nairobi very quickly. It was founded as a railroad camp. The British were building a railroad from Mombasa to Uganda. So as soon as they got there, the Maasai, they called the place of cool waters. Nairobi is their language. It was so malarious and there were so many mosquitoes that the doctors of the health project tried to get the place moved because all the coolies, all the workers were coming down with malaria. There were 5 major malaria epidemics from after World War I until the 1950s when DDT managed to stamp it out. I found, astonishingly, that the British colonial government put aside £40,000 in 1926 to control malaria in the Nairobi area. That's about $1 million in today's money. That was in 1926. I don't really know where the environmentalists get this idea of mosquitoes crawling up to Nairobi. Today, malaria is fairly... When we were filming for the Great Global Warming Swindle, I asked some of my colleagues who work on malaria, who are really the world's specialists in malaria, to direct us to a clinic where there were malaria cases. And my friend said, what are you talking about? There's bugger all malaria in Nairobi. So the other thing is that records there show little sign of change of climate. I thought I'd give you from Mr. Gore's school book. He has a book for high school students, slightly simplified from the high-tech book, an inconvenient. This is an inconvenient truth. And this is what he labels a mosquito. Now, if you look at this insect, you can see that the sticker is at the wrong end of the mosquito. This is actually a wasp. This is a wasp. And this is a tsetse fly. He's right about his tsetse fly. I believe somebody caught this when it hit the windshield of a safari vehicle, because you may notice it's got 4 legs. Insects have 6. It's lost 2 of them. So not very good education for our children. Here are the altitudes of malaria that are claimed to be the new altitudes due to climate change. And here are the recorded altitudes from 1880 to 1945. You can see that there's less malaria at altitude. Why do we have malaria? Why, in fact, is malaria increasing in many parts of the tropics? Deforestation creates a habitat. Open sunlit pools are the favorite habitat of Anopheles gambiae, for example. Changes in agricultural practices, for example, rice cultivation, irrigation. Movements of populations. When you have these terrible movements due to civil strife, for example, people who have not been living in malarious areas go into these terrible camps and there's horrific transmission of malaria. War and civil strife. Poverty. Poverty is essentially the best associated with malaria. We see very little malaria now in much of Southeast Asia, except, for example, in Laos, in Laos. But in Thailand, relatively small areas affected, as an example. Drug resistance, a problem which is a continuous problem. It's essentially a selection because of very often improper use of antimalarials, and of course insecticide resistance is a problem as well. Just one more issue on a disease at altitude. In 1992-93 there was an outbreak of yellow fever in western Kenya. You see here a classic place for yellow fever. The monkeys in the forest, people go into the forest, get yellow fever, and that's the way we call it sylvatic fever. The outbreak was in the Kerio Valley. Paul Epstein, one of the big alarmists, said it was due to Aedes aegypti moving up to mountains. I led the investigation. What we found was that there were no aegypti at all present in the villages, and we identified the vectors. People are worried about malaria because people are worried about tropical dangers, and the alarmists use this as their particular weapon to scare people. One thing that's interesting is they never mention the other tropical diseases, which unfortunately the public know little about. Trypanosomiasis, sleeping sickness, river blindness, elephantiasis, leishmaniasis, Chagas disease, loa. I bet you haven't heard of most of those, but they are major diseases which are never mentioned in the global warming issue. Very, very quickly, I will just run through what happened with West Nile virus when it was accidentally imported to the States. According to the alarmists, there is a climate factor in this. I don't know if you can see any more transmission in the southern United States compared to the northern United States. So what we have, to my mind, is a very serious situation. People are misusing the language of science in my field and in many other fields, essentially to inform the public and misinform the public. And my last slides, I promised you, we had a meeting in Moscow where Andrei Ilarionov condemned the British government for being totalitarians who were trying to censor dissidents. I never thought I would be in the Kremlin and defended as a dissident. In his book, he wrote, Lysenko discovered how little it took to capture the imagination of journalists in search of a sensation. Does that sound familiar? Lysenkoism showed how a forcibly instilled illusion, repeated over and over at meetings and in the media, takes on an existence of its own in people's minds, despite all realities. Does that sound familiar? And lastly, but not least, the great physicist, nuclear physicist Semyonov, Nobel Prize winner, wrote, "There is nothing more dangerous than blind passion in science. This is a direct path to unjustified self-confidence, to loss of self-criticalness, to scientific fanaticism, and to false science. Given the support of someone in power, it can lead to suppression of true science. And since science is now a matter of state importance, to inflicting great injury on the country." That was after the fall of Khrushchev, during the short thaw. I leave you with that thought. Thank you.